Hello everyone, we are here with the series Share Your Story with Aravind. Everyone has a story to tell. Today we have Dr. Arjun PC. Actually, there are various things like menstrual hygiene and all those things, and to speak about like LGBTQ and various other sexually transmitted diseases. To speak about all those things, people actually don't understand the significance of knowing it, and actually they think it's a stigma. So it's always making the stigma is essential. So medical people taking the initiative is most crucial because they understand why is it essential and they don't feel like it's a disgusting thing. So today we have one such person. He's a final year student in Calicut Medical College, writer, researcher, and a social activist who stands for LGBTQ rights and also for mental health and rights of the medical profession. The first one who started the hunger strike against NMC bill by central government on 2019. Then now he is the present president of SNO Kerala, former state convener of IMA-MS in Kerala and AIMSA Kerala. So former magazine editor of Calicut Medical College. Hi Arjun.
Hello Aravind, thank you for inviting me.
Thanks for joining Arjun. So let's start with your early years of life and your education.
Okay, so hello everyone, my name is Arjun PC. So my schooling, I am from Palakkad. My schooling started at St. Thomas Convent from LKG to the 12th standard. It is near my house. And at 12th standard also, I went to for the entrance preparing at the Jaram institutions or Shaktinambran College. And I wrote the entrance examination. I didn't got the first time. So I repeated again at the PC Thomas institutions of entrance coaching, and I wrote the KEAM examination, that is the Kerala entrance, and I got in at Alappuzha Medical College, and I wrote the all India examinations, and then I got into my dream college, the Calicut Medical College. So that's where I am right now.
That's nice, Arjun. And why did you choose medical profession? Is there any specific reason?
Actually, Aravind, I'm pretty much very much ambitious and involved in social activities, and I want to be a social activist also from my childhood days. And I very much look up to this doctor profession, this medical profession also. And there are many doctors in my family from my father's side. My father's mothers, sisters are doctors, so they have inspired me with their work. And one special thing I have to mention is that my mother's one of the sister is the first doctor among my Kakala community. So it also inspired me. There is this award called Ratnama Memorial Endowment Award, which will be awarded to the medical entrance students who gets entrance from our community every year. I always wanted to grab that trophy or that shield. So it inspired me much. And also some literary works also inspired me, especially to mention the Priya doctors from one of my Hindi textbooks, which was written by Punatil Kunya Abdullah. He's also a doctor. And that story has inspired me very much. And in that story, he shows a group of freshers coming to the college and one inspirational professor explaining the students about the profession, ethics and etiquettes of the profession. So yeah, from my personal life and literary world and from the world I see, I got very much inspiration, and I'm very proud to say that I'm a medical student right now.
Okay, Arjun, we came to know that why you came to medical profession and how you got interested in social activities. So, could you please share more about what are the social activities you have done so far?
So the start of my social activities actually began at my college itself. I would like to thank one of my teachers, Mrs. Kavidamani, for introducing me into the social service. Actually, she made me the leader of Echo Club in my school. So it actually started from my school itself, but it got a bigger platform at my college days, which is called the Independence. It is a non-political party, campus politics platform called Independence. It gave me a bigger platform to conduct my programs. To name a few, there is Zahari, Aham, Yosdoc, and Sanjeevani, which I'm really proud of. And to talk about Zahari is a breast cancer awareness program. So we conduct that every year, annually. It is celebrated at the October month because October is the breast cancer awareness month. So it actually started when I was in the first year vacation, and we friends together brainstormed in a WhatsApp chat that we have to do something to utilize this time and something useful to society. So I just Googled and found out that October is the breast cancer awareness month. And one of my friend named it as Zahari. Zahari means pink in Urdu. Pink is the color for the breast cancer awareness program the worldwide. So yeah, we started Zahari then. We conducted many awareness classes in and outside the campus and many hair donation campaigns, many pamphlet distribution. It is now a tradition to conduct Zahari every October, and I'm very happy to see that it is running very successfully throughout these years. And the second initiative which I have to mention is Aham. Aham is a pro-LGBT organization, not organization, a venture in our campus. So it says that it was actually started to say that it is okay to talk about LGBTQ issues in campus. It was the first of its kind in any medical colleges, I think. We conducted many talk shows by inviting guests from all the gender community, different spectrum of genders, and lesbians, bi, transsexual, asexual people, intersex people, transgenders, activists who work for the LGBT community. We invited all of them to have a talk in our campus. And that was the thing we have done inside the campus with respect to Aham. And when we take Aham to the outside, we conducted many awareness sessions in many other colleges, schools, and also through the online platforms, we have conducted many infographics by publishing articles, by responding timely with the current matters in the LGBTQ community. So that's about Aham. Now moving on to the, should I talk like this or?
Yeah, you can.
It's fine, right? Okay. Now the third session, the third program which I am proud of is Yours Doc. Yours Doc is an online phone-in live program for doctors, and it was that a topic and the name of the doctor will be released 2 weeks or 1 week prior to the FB live session, and any audience can ask their doubts through the comment sections and all. So it is also running successfully for I think 3+ years. And the fourth initiative is Sanjeevani. Sanjeevani is a blood donation awareness campaign. We have conducted many camps in our campus and also outside campus under the banner of Sanjeevani. These are some of the programs which I'm very proud of myself.
It's really nice you have that made a lot of initiatives that, and also we understand that it is not really difficult to all those things. Like each medical college, if they come out with a new initiative, it will be like a great awareness for all those people, right? So coming to the LGBTQ issues, like how did you got interest in doing that specific thing? Because doctors actually, many of us don't know what is LGBTQ one thing, and many of them doesn't understand the significance of why it is essential. Like speaking about it, they don't think that it is a social disease or social stigma. They don't feel the necessity to speak about all those things. So how did you got interest into that actually?
Actually, the answer is in your question. Actually, those things, those stigmas are the thing which actually stimulated for the formation of the program called Aham. So the first incident which gave me a stimulus was that when I was posted in the medicine ward, we have to take history like drug history, surgical history, previous past history and all. So when I talked with a patient and asked for any surgical history, he said no. But the bystander came and whispered to my ear that he had undergone a sex reassignment surgery. He was a female, now a male, he said. So it was very shocking and like I got a new info from a bystander, but I'm studying in a medical college and I haven't got that information from any teachers or my friends. So I got back to my hostel and researched about the topic, and I learned much more about the topic, and I came to know a big horizon. It widened my horizon actually. Got to know much about the lesbian, bisexual, trans, asexual, different spectrum of people who is living amongst us. And there are many people belonging to LGBT community in my campus also. So I wanted at least the doctors to know about the existence of these people. So that's the first. That was the first objective of mine when I started Aham, to have a platform to talk about these issues. That was the first objective, and it was conducted inside the campus at first to make aware of the doctors, and then it was taken outside. So regarding the stigma regarding this topic, I would like to point out two incidents. So we had to get permissions from the professor community also to conduct any programs. So one of my physiology teachers commented that the common people are not very much interested to talk about this topic, and why should you medicos have to take this topic? And I was very shocked. She was a very senior professor in my college, and she thought that it's a waste of a time for medicos to talk about this thing. And also one other incident is that we had put a very big rainbow rangoli in our portico of our college as a start of this program, Aham. And we had an opinion book kept beside that to mark the opinions of any people, any patients, or any professionals. So then a nurse came and write like that, it is a disease. LGBTQ is a disease. It can be treated. You should not stand for these guys and all. And we had a little bit of quarrel with that nurse also. So these two incidents were very shocking, and many students also were very much, what can we say, offended to take up this topic and to conduct this program. But when years have gone, we have seen that there is much support in my college, and we were able to conduct fashion shows by LGBTQ people along with the organization called Dwaya, and they got very much appreciation from the medical community from my college and other colleges also, and we were able to invite chief guests, LGBTQ people as chief guests also. So that's the experience regarding the start of Aham.
Yeah, only after the section 377 became like it's non-punishable, like in September 8th of 2018. Before that, many people doesn't have awareness about that. And also even like medical students, we study that in forensic medicine, but we don't actually realize that this many people are there. We don't know actually about all those things. So after this kind of awareness only, we as medical itself come to know about what are the issues of them, so that we can contribute little towards them. So is there any other social activities which you have started or which you are participating in, through which you are doing a lot of work?
So, and I would like to point out a program called Shades of Blue, which I forgot to mention earlier. Shades of Blue, the name, feeling blue means feeling depressed. So that's how we got the name, Shades of Blue. We have started this mental health campaign. At first, it's in the initial stages right now. It has started rooted in our campus only. So we have set up a emergency or exclusively emergency helpline for medicos in our college by tying up with the psychiatric department. So we have put up a 24-hour helpline number. We have bought a phone and a SIM and given to the PG who has the 24-hour duty. So any UG or any PG who has any distress at any point of the day can call to that helpline and ask for help. And if they want a one-on-one consultation, they can also ask for that. Or if that is really necessary, the PG itself will prescribe one-on-one discussions also. It is found that it's very effective, and many calls are getting. We do reviews now and then, so we are getting very good reviews.
Okay, that's nice, Arjun. So tell me more about your writing works, the things which you have fought for rights of the medical students, and more about this.
Yeah, regarding my writing works, I was a very average reader in my school days, but I got into much reading when I came to the college. So I got much interest in writing also. I started with very small poems, like haikus and all, and I got into the editorial board of the college union for 3 to 4 years, and I was the previous editor of the college magazine. The magazine is under work right now. I'm very excited. So within 1 or 2 weeks, it will be published. My first magazine, which I am the editor of the magazine. So that's about the writing works. I also have a blog in Facebook called Ulla. I usually update that from now and then. That's about my writing works. So moving on to the works I have done for the medical fraternity, I'm very proud to say that I got a platform called IMA MSN. As we all know, we both are the platform part of IMSN, and it gave me so much opportunity to stand for the profession, whether it's about mixopathy, whether it's about community health providers by the government, whether it's about the most draconian NMC bill, National Medical Commission bill. I was able to start the hunger strike at 2019, even though the NMC was introduced at 2016, I think. Uh, I'm very happy to be part of that movement. We all want to do something for our profession. So when I came to know that, when I seniors like my one of role models like Ashwin Sujit and Ajit Paul said that there is this thing and you have of the Kerala. So we together discussed and went for the hunger strike. Just by discussion at a one night, 1 or 2 hour discussion, we decided to go for hunger strike. And I was very happy. Even though the result was not completely abolishing of NMC, but few changes were able to make by the protest by students, and I'm really proud of it.
Okay, that's nice, Arjun. So do you think, is it essential to be part of various social organizations or part of various social activities that is happening in our college? Like, is it essential to build all those skills during the medical, like during our college days itself?
I would say it is not essential, but it can be an additive, a synergistic thing to be in an organization. One fine example I can give is yourself. You, Aravind, you have started this YouTube channel. It's going very successfully, and you are interviewing so many young people who inspires us. And you are a one-man army. But when it comes to social workers, we have to have a bit of a connection. We have to have a bit of a network when it comes to social service. So it can give much more exposure, and it will amplify our voice also. And if at all when some personal issues comes, we can fall back, and there are people to catch upon, and they can take up your work forward when you are very down and when you have any other engagements also. So yeah, it is good to have a not political, an organization or a group of people to support you, so that you have that back support. Unity is strength, just like that say, when so many people stand for one thing, I think it can happen.
Okay, that's nice, Arjun. So we have almost come to the end of the interview series. Like, what is the action plan that you would like to give to our audience? Like, because they don't want to watch the thing, just get motivated and just move on. They want to take some action always. So what is the action plan you would like to give them?
Actually, I have to say I don't have any future plans, but I just live the moment, just seize the moment. I have to say, if you get any platform, if you get any chances, just like I got the chance to do a hunger strike when NMC came, just like I did Zahari, Aham or US Dr. Sanjeevani when I got independence, when I did my work for the medical fraternity because I got the MSN. So utilize the platforms you have, seize the moment, like analyze the moment right now where you are, and just utilize it. Just leave the moment, just seize the moment. That's it.
Okay, Arjun, thanks for sharing your views and sharing your personal experience in this video. So friends, I hope this video will be useful for you. And whenever you're going to share your story with me, I'm always eager to hear your stories also. So see you in one another great person like this. Until then, it's Aravind signing off. Bye. Thanks, Arjun.